We're not talking about Bartonella. Now, Bartonella is an infection, as you point out, which is transmitted in a completely different way by transmitted in cat saliva via scratches or bites, and causes quite a different illness. It's relative.
Are you saying it's not a co-infection of a tick bite?
Not in my experience, but we see a lot of Bartonellosis, particularly in children, but it's usually associated with cat scratches or cat bites.
Right.
But that's only one species of Bartonella, which is known as cat scratch disease.
Yeah.
Are you telling me when the patient comes to you and you suspect Lyme, you send their blood off? If you're a GP in Grampian, do you realise it goes to Southampton and not to Inverness?
Well, I mean, I'm not entirely sure what the relevance of that is, Rodney, and in that I'm no way disparaging your point.
Okay, well, can we talk about tuberculosis then, please? Because tuberculosis and Lyme are both persistent bacteria.
Right, Rodney. We can't really speak about it just now, just because we've got so many calls coming in, and we just really need to move on. But I mean, it does point up the level of potential confusion that one can get arising from an initial Lyme disease diagnosis. We've got some interesting emails here. Sarah Jane, I'm a 32-year-old female with Lyme in Glasgow. I had to push to be tested, and then it took 5 weeks to get my results, then a further 2 months until I started treatment. I had 7 weeks of treatment, which I had to fight for. I wasn't any better at the end of it. They simply told me sometimes antibiotics work, sometimes they don't. I would normally run, cycle and swim every week. I haven't for 8 months. I bought a book from an American herbalist, which I would recommend to Scottish doctors, as it's full of medical trials. That's been positive so far. Ian and Aaron says, my wife contracted Lyme disease in 2005 after being bitten by a tick. She was soon suffering extreme back pain and was referred to Cross House Hospital by her local GP. Her problem was not identified. Her condition worsened daily. She was then transferred to Southern General Hospital, where eventually Lyme disease was identified. She spent almost 5 months in total in hospital. I mean, these are very, very serious effects, aren't they? Today she still suffers the effects of the illness, which has resulted in a frequent periods of depression, problem with her digestive system, has lost the normal use of her left foot and leg, causing problems with balance and mobility. Dr. Seaton, the range of symptoms that we have heard various people attribute to Lyme disease is quite incredible, isn't it? Are all of these recognised?
Well, first of all, it's a relatively... It's an infection that's becoming more common. The vast majority of people that have Lyme infection, it will be a self-limiting illness. Some people will get an illness that requires a course of antibiotics. It's really the minority of people who develop the neurological symptoms. So I mean, again, I've got great sympathy with Ian and his wife and the problems that she's had as a result of Lyme, but certainly these effects are recognised, although they are certainly in my practice and my colleagues, these are rare. But
I must say, obviously, we want to be responsible about this, and you said, Richard, that we have to get it into perspective and people shouldn't be terrified. But having said that, it's fair to say that we really have been swamped this morning by calls from people saying that they feel that they have been misdiagnosed and have suffered long-term debilitating effects. So it's clearly an issue. But before I speak to Craig and then Ellie, Richard, what do the Lyme campaign group want then, in the light of all of these stories and the many more that I'm sure are there?
Well, Lyme Disease Action do take a fairly sober view, and they're not particularly keen on patients going private, and especially not patients going and seeking out cheap antibiotics, on the internet and that kind of thing. They're very much aware that patients are worried about it and are likely to take action outside the NHS. So they want the NHS to act. And what they really want is something that I think Andrew would say isn't worth doing, which is more clinical trials of antibiotics on long-term Lyme. There have been some trials, as Andrew's told me, that have found fairly positively that long-term antibiotics aren't of use. But the anecdotal evidence from all the people involved in Lyme Disease Action is that they are getting better with antibiotics, that they are having a beneficial effect. And they say what could sort of settle the deal, as it were, would be a properly run clinical trial. Now, how that would be funded, whether it be worthwhile for the NHS to fund it or whether for a drugs company to fund it, I don't know. But it would seem to me that's what they're after. That's what Lyme Disease Action really want, is to try and put the debate to bed, as it were.
Does that not sound quite reasonable, Andrew?
I mean, I think superficially it does sound reasonable. There are there are some question marks over some of the more serious complications of Lyme disease and what exactly is the best way to treat patients. But to extrapolate that to everybody with Lyme is dangerous. We do know that people who have
they're talking about doing another trial in order to establish
long-term symptoms following a recognised course of Lyme treatment has been examined in a huge study in North America, which was powered to show differences in outcome, and the placebo group, the group that didn't receive antibiotics, who received dummy treatment, had the same long-term symptoms as those patients who received the active ingredient, the active drug. So, I suppose in my mind that trial has settled it. Whether there is not the patient population in the United Kingdom to replicate that study.
I'm sorry to cut you off. It's just that we've got another couple of calls I'd really love to get in before the end of the show, and we're careening towards it. Craig, morning, Craig.
Good morning.
Good morning. What's your situation?
I'm very concerned about the state of diagnosis and treatment of Lyme disease in the UK.
And why is that?
Because I'm aware of it. I don't suffer from it, if that's what you're asking.
Right, okay. And what's your cause for concern then, Craig? I mean, apart from listening for the last hour.
Well, I was phoning really on initially one point, but a couple have risen. I'm aware that a national expert panel on new and emerging infections reported in 2004 that Lyme disease currently poses a significant health threat in the UK, similar to swine flu. Yet there is no public information available from GP surgeries or awareness campaigns on the radio or on the TV.
Yeah, well, I mean, I would certainly take your point there, Craig. I'm not sure about the analogy with swine flu, but in terms of awareness, it would appear that, Andrew, you would also acknowledge that there needs to be more. Can I just take the chance to remind everyone that we have got Scottish Conservative leader Annabel Goldie joining us tomorrow. So if you have any questions or calls for Annabel Goldie, then please get in touch. You can email your questions now, actually, callk@bbc.co.uk. It's 2 minutes to 10, and we've just got time to speak to Ellie in Hexham. Good morning, Ellie.
Good morning.
Good morning. What's your story?
Well, it took 7 years to diagnose me, 25 specialists. I had hot flushes. They thought I was going through menopause. I was just looking for an answer. They gave me a complete hysterectomy, unneeded. Heart palpitations. I've been in and out in A&E. They thought it was all in my head. I finally had to go private. I found a doctor in Newcastle who is a gem, who has actually helped me. I've been on antibiotics now for about 2 years, IV, everything. My GP still will not recognize it.
Wow.
And I had a blood test. In my medical records, 5+ years ago, it mentioned Lyme disease. They never took a test. They refused to take a test. They finally took a test after I had my IV.
Right. After
I had IV treatment from my gem of a Lyme specialist in Newcastle. I am so angry. Everything this doctor's been saying that you have, sorry, Kate, I just don't believe what's coming out of his mouth. There is thousands of people that are suffering unnecessarily.
Well, Ellie, I'm sorry we've got your call in so close to the end of the programme. It clearly is a bit of a can of worms. I keep using these terrible analogies, but I mean, absolutely shocking stuff this morning. I don't think we've reached any conclusions, but I hope we've highlighted something. Thank you very much to Richard Baines for that investigation, and to Dr. Andrew Seaton.
92 to 95 FM, 810 medium wave, and on digital. BBC Radio Scotland. The news at